Health Corner, and now we're talking cervical cancer, which is a cancer that is found anywhere in the cervix. Now, the cervix is the opening between the vagina and the womb or uterus, which is part of the reproductive system, and is sometimes called the neck of the womb. Various strains of the human papillomavirus is a sexually transmitted infection, plays a role in causing cervical cancer. We're joined this evening by Dr. Shayela Makemba, who is a general healthcare practitioner, to educate us more on this form of cancer and its effects. Doctor, thank you so much for being with us tonight.
Thank you for having me.
Doctor, explain to us what exactly is cervical cancer.
Like you have said earlier in your introduction, what happens is that in your reproductive tract or the reproductive tract of a female, the demarcation between the vagina and the uterus is the cervix, also often referred to as the neck of the womb. Now, this human papillomavirus is a virus that oftentimes is transmitted to a lady via sexual contact with their partner. Now, if this human papilloma virus then get to the cervix, what it does, it then causes changes on the cells of the cervix. Instead of, the cervix being healthy, this cell then overproliferate and grow abnormally and become cancerous. Actually, that's how one end up developing this cervical cancer.
Yeah. What are the symptoms of cervical cancer? How do you know that something is amiss?
Yeah, oftentimes a lady might present with abnormal bleedings. All right. Then, of course, these discharges, they can be watery, bloody, foul-smelling, and there's an element of pain to it. They might often have this recurrent lower abdominal pain. We call it suprapubic pain. It might be pain when one is being intimate, or in an act of sexual intimacy, then it becomes painful. Or just generally, the lady feels their pelvic area, it just feels uncomfortable. It's painful. It feels, bloating and full. Those are telltale signs that could indicate and point to the fact that possibly there could be something going on in the cervix. Yeah.
Pardon me, does having HPV or having cervical cancer cause infertility in women?
It will then depend to what extent is the cancer.
Right.
Because let's say if it's a young lady, she probably doesn't have children yet. If she does pick up cervical cancer, perhaps if it's not picked up early, and maybe the infection, it's then putting her life at risk. Sometimes the intervention to help her get rid of the cancer might mean taking out the whole cervix and even the whole uterus, which is called total abdominal hysterectomy. If that is the consideration, on that front, she might actually, then end up, becoming infertile now because the uterus is taken out.
Right.
Yeah.
What are the treatments, doctor, for cervical cancer, and how effective are they?
All right. First and foremost, if, for instance, it's picked up early and maybe just localized to the cervix and it hasn't really spread far, a procedure called a Let's biopsy can be done.
Okay.
Where, you go in and you cut the tissues around the cervix. You try to get as wide the margin from what appears to be abnormal. That might be curative if the cancer has not spread. But then, of course, if there is fear that there could be spread, one can opt to do what we call a trachelectomy, where you cut out the whole cervix. And then, of course, worst case scenario, like we have said, total abdominal hysterectomy, where you remove the whole womb plus the cervix. And of course, chemotherapy and radiation then, of course, become one of those cardinal, management, procedure, especially in aspect of cancer. So you get sent to an oncologist, which is a specialist doctor who specializes in managing cancer. And then, of course, they do that just to make sure that they burn all possible cells, so that it doesn't recur or start spreading again.
What are the prevention methods, doctor, of this cancer? Or in what way can one mitigate one's risk of contracting, cervical cancer?
Right. We look at things like we advocate for young ladies to go for human papillomavirus vaccination. Protocol-wise, a girl as young as 12, perhaps, and especially before she starts engaging in sexual activity, even better. She will get her first injection and then the second one a month from or 3 months from the first one.
Okay.
And then, of course, if maybe somebody is sexually active already, oftentimes the procedure is more or less the same. You get the first one, and then after a month you get a second one. and then it's repeated 6 months later from the first one. And this procedure can then be repeated every 10 years.
Okay.
Okay, that can actually come a long way in helping you now, protecting you from the HPV that will eventually cause the cancer. Of course, we do advise women that are sexually active to get into the habit of doing routine pap smear, which is a screening procedure that can then pick up the cancer if it is there early enough so that it's managed properly. Now, we say between the time that a woman becomes sexually active up until the age of 40, probably at least one pap smear every year is good enough. When you're a little bit older, over the age of 40, it's probably advisable to do it every 6 months. And then, of course, if it's picked up early, it's managed promptly, that can save your life. Then, of course, we also say, advisably, if your partner can get circumcised, that then become a protection measure from your partner, protecting you as their partner. And, of course, safe sexual practices, And then we also have seen that sometimes if a young lady engages in sexual activity very early in life, that increases their risk of ending up with cervical cancer. So if young ladies can learn to delay a little bit up until they are quite matured enough, that actually become a protection to them as well. And of course, the aspect of maybe having more than one partner is probably discouraged, because then you increase the risk of picking up HPV from one of these partner.
Yeah.
So that then become a risk as well. If one can mitigate those kind of risk factors, you might actually stand a better chance in protecting yourself.
Yeah.
And women that smoke also, oftentimes smoking then becomes a risk factor to all other types of cancer, not only cervical cancer. So it's advisable for young ladies not to start smoking, and if they are smoking, it's probably in their best interest to consider stopping.
Yeah.
Yeah.
Doctor, it's always a pleasure talking to you, and thank you so much for joining us this evening.
Thank you for having me.
That was Dr. Makemba speaking to us this evening in our Health Corner about the issue of cervical cancer.